A computerized physician order entry, or CPOE for short, is a process where a physician electronically enters their instructions to treat their patients, particularly for their hospitalized patients. It is a very important tool, specifically for physicians to manage prescription orders and watch how their patients take it so that they can make sure that the patient is not taking a dangerous dosage of their drugs. Unfortunately, it has not been used as efficiently as it could be. Based on a 2015 hospital survey, CPOE systems failed to send alerts for 39% of potentially harmful drug orders and 13% of potentially fatal orders. This system hasn't improved in the past 5 years since 2014, according to Erica Mobley, the Director of Communications and Development at Leapfrog Group. Leapfrog Group is trying to make the CPOE systems better and more modern in order to keep up and do what it's supposed to do. Every year, a discovery or more knowledge is unearthed about drug safety, and if the CPOE system does not improve along with this increasing knowledge, we are willingly allowing the deaths and injuries that occur due to wrongful drug usage to occur when we could have prevented it. Some ideas to improve the system is to simply make more alerts and to warn physicians and nurses many more times so that they can act ahead of time and prevent any overdoses or fatal drug usage. However, the fear of this is that alarm fatigue would occur, where the physicians and nurses would start to tune out the warnings due to the excess number of alarms coming in. The CPOE in general, though, is on the right track. It is making the correct movements towards taking prescriptions a safe process. And on the bright side, 96% of all U.S. hospitals meet Leapfrog standards for CPOE implementations, whereas in 2001, only 2% did. The CPOE is a very important tool and can be used very efficiently to maintain records and keep patients safe, as long as we keep it up to date.
Hey guys, I'm going to talk about EHR, otherwise known as electronic health records. Electronic health records are capable of being shared across all types of healthcare settings by being embedded in network-connected enterprise-wide information systems. I believe that this system is valuable because it combines data from all types of healthcare facilities, such as pharmacies, laboratories, and radiology. EHR is a system that will thrive in the future. Within the healthcare system, there are plenty of challenges that hinder the success of EHR. For example, inconsistent quality, gaps in care and access, and high and rising expenditures. In order to combat the challenges that the healthcare system faces, healthcare information technology and EHRs have been thought as possible solutions. It is fascinating to me that EHR systems have been around for over 30 years, but since 2006, less than 10% of hospitals in America have a fully integrated system. I believe that in order to improve the overall stability and effectiveness of healthcare, overall, EHR price tags need to be reduced so that healthcare providers can benefit financially.
The EHR is currently a very useful system to gather patient information, but I think what it really needs is for it to be standardized and heavily controlled. It needs to be standardized in terms of how the information is stored, the format it's in, and who has access to it. Currently, the EHR is accessed through many different applications by many different types of medical professionals, so having one record that could be looked at for every need would be beneficial. However, making these changes also poses a security risk because of the amount of people that will have access to the information. If the system is truly centralized and adopted throughout the entire country, then there would be too many instances of possibility of a data breach. I'm on the side of centralizing the data to the EHR since it can have many benefits for medical professionals, and a privacy breach will always be a possibility whether the data is centralized or not.
So discussing application of EHR in healthcare. Looking at business trends, EHR is in stage 2 and approaching consolidation stage. Stage 1 is initiation, which is where a startup will focus on a specific issue within an industry and develop a product specifically for that problem. thereby gaining credibility. And then stage 2 is acquisition, where larger companies seek to buy out a smaller market, but often struggle to integrate the new products with their own existing ones. And then stage 3 is consolidation, the final stage, where companies that currently dominate the market will either become standards for the industry or fall out of the industry altogether. And large companies like IBM, Intel, Microsoft are all becoming really interested in developing EHR related technology, but as of right now don't really have a lot of precedence in clinical product development. The future vision is to create tools and standards for a network that could push for better interoperability among medical communities. And the reason this is so important is because it can help increase safety and security of patient records, help avoid medical errors that are both costly in terms of money and patient care, and also just creating technology that will aid the medical community in analyzing data in order to better understand the problems affecting large groups of people.